Hello and welcome to the fifth episode of the Pepper Podcast. For those who are returning, welcome back. And if you are new, the Pepper Podcast covers a wide range of spicy events that occur in our daily lives. Two high school students tackle heated topics through discussion. I'm your host, Jay Mehta, and joining me is my co-host, Andy Watson. And today's topic will be covering the gender and racial disparities in medical fields and how societal constraints and people's mindsets have caused a fear of pursuing careers in medicine. According to the AAMC.org, in 2019, only 36.3% of women comprised the physician workforce. However, this is a major stride from 2007, when only 28.7% of the women comprised the workforce.
We will be exploring these inequalities and prejudices in the medical field, starting with gender skewed specialties. So,
I think this is something that's really interesting because there's, gender's dominated specialties that you hear of. And I guess like this is created a mindset where people are just thought of to be in that general profession. And instead of, going out and pursuing further education, they're just staying there at their job. Um, and then there's also like dominated specialties, which also relates to, like other male dominated professions and female dominated
yeah,
professions,
yeah.
but mainly like for notably a few for female dominated, we have our like pediatrics, allergy, and medical genetics, while in male dominated specialties there's orthopedic surgery, neurological surgery, thoracic surgery, radiology, a lot of these more surgical specialties, while in
Yeah.
female dominated specialties it's more like allergy and immunology, pediatrics,
Yeah,
genomics,
yeah.
more, and then hospice. So
Hmm.
um, our nurses and things like that. So I feel like
Yeah.
there's a stigma around these like professions, and I feel
Hmm.
like these haven't been changed for a long time. And I feel like
Yeah.
with more women comprising the workforce, joining the workforce, that I feel like it's important to allow, or just anybody in general, I feel like it's more important to allow people to choose what they like, and if they'd like to go to that education, pursue that education, they can. But I feel like something that's preventing that from happening is number one, like college acceptances, and number two, um, like racial, I guess, discrimination. Um,
Mhm.
in I guess like college acceptance, and at the same time in the medical profession or the medical
Yeah.
field.
Yeah. And I think that the topics that you discussed, especially like the gender skewed specialties, in which like you see a higher prevalence of females having jobs in like OBGYN and pediatrics and hospice, it to me it seems like there's a trend between like societal constraints and
Mm-hmm.
societal gender roles
Yeah.
where like women are supposed to be seen as the caretaker
Yeah.
or are more emotional or like more down to earth and more connecting with people, and like they have to take care of the kids and stay at home and cook like that.
Mm-hmm.
I think that that definitely carries over to the medical field because you see a lot of women, in pediatrics where they're caring for kids and families like that, whereas tech men you see a high prevalence in like sports medicine
Yeah.
or like your general surgeons, your
Mm-hmm.
emergency medicine physicians, your yeah,
Yeah.
your more like intensive, hands-on, analytical
I agree.
specialty.
I feel
Yeah,
like OBGYN should be a more female dominated specialty
that
though.
makes sense to
Yeah.
me. Yes.
But again, what you said is pretty accurate. There's a
Yeah,
um I guess an ideology around it, societal ideology. Um
yeah, and I think that like what you said with like it makes sense that OBGYNs. I think that is also an exception. Like it has been proven that like most women prefer their like gynecologists to be a woman because they literally relate physically,
mhm.
or like if you were born a woman, like you have those parts that your patients have, and so it's easier to relate to and easier to
Mhm.
like work with the patient in
Yeah.
that way, and it's yeah, and it probably works vice versa with men
It
because
it
like
might,
I,
yeah.
yeah, because like I remember like going to the doctors like for checkups, and like if my doctor was a woman and it was like a
It's
daily
a lot
checkup, I
more
feel
it's a lot
very
more uncomfortable when it's
it
the
was
opposite gender.
uncomfortable.
Yeah.
Yeah,
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 I
no,
agree. But I guess moving away from physicals, I guess we can talk about um I guess like racial discrimination also that we are talking about previously, about how like
Yeah.
racial discrimination has led to not only fear in the work and in like the medical workforce, but it's also led to like a decreased amount of some professions or like some races in the profession. So like
Yeah. Yeah.
I guess just like a general I guess like a data dump for just for a general basis, around 56.2% um of I guess physicians are white. 17.1% are Asian, 5.8% are Hispanic, 5% are Black or African American, and then the rest are unknown or indigenous
Yeah.
or multiple race.
And that is definitely an issue because especially with very underrepresented groups, severely under, like the
Mm-hmm.
Black community or like the Latinx community, the Hispanic community, they have such little representation in the workforce in the medical field.
Yeah,
Like I don't know if I've ever even had a Black or Hispanic doctor
I don't think I've ever had. Yeah, like
or
literally
medical professional.
every like underrepresented population or like minority population, all the populations combined, including the unknown, is still less than the white doctor or white
Yeah,
physician population, which is, I
and
guess,
like
something that's
that makes sense,
yeah,
but it's still an issue
yeah,
because while yes, the majority of the population in America, which I assume that data is
it
derived
is.
from, yeah, in America is white, that does such a disservice to the millions of people of color because um, I recently did a paper on medical disparities
Mm-hmm.
and in race, and it was shown that people of one race prefer to get taken care of by a person of that same race because they feel
Mm-hmm.
more comfortable and feel
Yeah.
understood by that race. And so, like, if you have a lack of black doctors, in areas that have like black prevalence with a large population, they're not going to see that representation that they want. They're not going to feel as comfortable as
Yeah.
they would
Yeah.
feel.
I get feel
And
like there's
it's
like an
also,
understanding factor that's important.
yeah, yeah. And it's also been proven that like black women, like especially as like for example pregnancy, they have a higher death rate for their baby and for the mothers than white women.
Mm-hmm.
And that is alarming because like while doctors can say, like, no, I don't discriminate against race, it's not something that one person is going to admit openly, right? It's like a subconscious thing
Yeah.
that like, oh yeah, like for example, like that one myth that black people can't feel pain.
Mm.
Like, are you kidding me? Like, they're people too. Uh, they have, they're just different, like heavily melanated. Like I'm darker in complexion,
Yeah.
right? But I still feel pain. Like,
Yeah.
it's not just one race that feels pain, and it's not one race that deserves the best treatment, right?
Yeah.
And
Yeah.
I think that increasing representation and it's inspiring children of underrepresented groups, can definitely
Yeah.
increase their interest in a medical field.
Yeah, I definitely agree. I feel like we need more underrepresented populations to enter the physician workforce and the medical field because there is a severe, significant lack of them. And I feel like you said, um, number one, an understanding factor is important because it allows for people to relate with each other. And so if you have a more I guess like homey or open feel to people, and
Mhm.
there's more of a connection that
Yeah,
it'll be a lot easier for the patient.
yeah,
And so a lot of um, like uneasiness is created with, um, unfortunately, with race. Um,
yeah,
and I feel like through because like that's not something that can be outright solved. Um,
yeah,
because it's just been programmed into our head so much.
Mhm.
So I guess something that's important to um, have, I guess, because we can't fully fix that, is to
yeah,
increase the amount of um, underrepresented populations to join the workforce, which is important. But
yeah,
also, like, there's other kinds of ways that people can get involved in order to, like you said, spread awareness and to inspire young
yeah,
children, right?
yeah,
Um, using your voice to express how important number one healthcare heroes are, especially during this time period during COVID. It's very for people in healthcare, it's very rough.
Yeah.
And so really highlighting how important of a job it is can inspire young people to, um, I guess, think about the profession, which is something that's good.
Yeah. No, I agree. And I think that relates to an initiative I started called Med Diversity, in
Mm-hmm.
which me and my friend, my co-founder, we interview doctors. We interview doctors, and especially doctors of races that are underrepresented in the medical field. And
Mm-hmm.
what we do is we ask them questions pertaining to what they see as a major problem, what they how they've overcome those problems, how they've dealt with that, and like possible solutions.
Mm-hmm.
And um, I asked the doctor. Her name was Dr. Mongol, and she was originally from Africa, so she emigrated from Africa to the U.S. And so she works in the U.S. now. And what she said was one of the most important things in her in what inspired her to become a doctor
Mm-hmm.
was that when she grew up in her country, right, there were only black doctors.
Yeah.
There, so pretty much like representation. You want to see somebody who looks like you in a position that's as prestigious as, a medical professional.
Yeah.
And I think that was really mind opening because I was like, I never thought of it as being that important. Like, yeah, representation is important, but I didn't know that it affected children on that much of a level because
Yeah.
she felt that, oh, they look like me, right? So that means I can do anything I want.
Yeah. Children take huge inspiration at a young age from people that they look up to,
Yeah.
even if it's something as small as just like the same, I guess, general color of skin.
Hmm.
Race, seeing, looking up to somebody of the same race as a role model is something that's so important for youth to realize,
Yeah.
um, because like I feel like everybody has been influenced by somebody, and being from it, like I'm not exactly from an underrepresented, but I am from a minority population here.
Yeah.
And seeing people that are venturing into unconventional, not necessarily pertaining to healthcare industry, but just in general, people that are venturing out of the general stereotypes, um, is something that people look up to because it shows
Yeah.
that we aren't limited to just one profession. We can be whatever we want to be. And
Hmm.
again, this doesn't relate to just healthcare. This is something that's important for all populations to realize that
Yeah.
number one, like the workforce is only as strong as how many people enter it, right? So if we
Yeah.
don't have many people entering the workforce anymore, I don't know about you, um, Andy, but we have an extreme shortage of bus drivers. Um,
Yeah.
so
Yeah.
if there's like not many people entering a certain workforce, that workforce is going to die. And
Hmm.
I feel like we're always going to need doctors and we're always going to need physicians. But just keeping that funnel going and going and going is something that's
Yeah.
important.
Yeah. I agree. And what I think is an important thing to mention when we say like we just need more representation in the medical field, like from the underrepresented communities. But
Yeah.
there's a reason, like
Hmm.
there's a reason that they can't get that representation
Yeah.
because communities of lower socioeconomic status tend to be communities that have heavy populations of those underrepresented communities, especially like your African American community and your Hispanic community. And so like um, citing to some research again,
Hmm.
like there's this notion that you can only escape the cycle of poverty or escaping the hood
Yeah.
as the
The
article
general fund.
claimed,
Yeah.
yeah, by being an entertainer, by
Mm.
being good at sports, by being a music artist, and which is simply not true.
Hmm.
But there's so much pressure from society and and the community surrounding them, but also from other races and like, oh, why can't you be like like this other why can't you be like that person
Yeah.
who who's already better off because they don't have to struggle to survive every day and can focus on school, you know? And so they they're already put at a disadvantage when they're trying to get into the medical field, because to get into the medical field, right, it takes a lot of work, effort, and especially money. And if you don't have that foundation, if you don't have the money, if you don't have the
Hmm.
education
Yeah.
required, if you don't have those necessary skills that are so important, you're not going to make it.
Yeah, I agree.
So I think we need to like go back even further to increase that representation.
Yeah. It's a good thing that you mentioned like socioeconomic status. Something that's again preventing underrepresented populations from entering the workforce is a lack of funding. Something that's very important is that underrepresented populations from a low socioeconomic stance cannot
Hmm.
afford to go to college, even though that if they could be smart and have the knowledge,
Yeah,
they cannot
yeah.
afford college. They cannot afford to stay in medical school. They cannot afford to pay rent and things like that. There's other I guess outside external factors that are
Hmm.
influencing their decisions. And being from a low socioeconomic background, it's very difficult to become a doctor, which is a very generally high paying job, when you're from a low socioeconomic stance, due to, number one, you'd have to pay back, loans and things like that, help your community out.
Yeah.
It's a very different, um, I guess, environment. It's more like a radical kind of shift. But again,
Yeah.
that takes time and will, and
Yeah.
perseverance. But again, it's a lot harder for you to make that shift, especially due to a lot of factors that influence your decision of becoming a doctor.
No, I agree. Yeah. And so that was one of the points of the med diversity.
Hmm.
And like what I'm planning on doing sometime soon is going to, schools with with like prevalent populations of underrepresented communities, and just educating them on the topic and showing them like, yes, you probably will face these barriers. However, this is how this is how you could help overcome them, and just like general concepts and stuff like that. Because I the medical field is one of the most like in demand for diversity,
Hmm.
like all of the fields of work, because it plays such a critical role in human society, because it's human health and physiological well-being,
Yeah.
that you know you can only benefit from having increased representation, from having more diversity.
Hmm.
There is pretty much no negatives to that.
Yeah. And when it comes to the idea of, if there are underrepresented populations in your area, something that's important is combating unconscious bias. I feel like this isn't talked about a whole lot. You may not say it, but everybody generally thinks it. Unconscious bias is a deeply rooted instinct that helps humans make decisions effectively by drawing
Yeah,
upon previous sensory exposure and experiences, according to Get
exactly.
Healthcare,
Yeah,
gehealthcare.com. So, like,
yeah.
um, I mean, it could be helpful in some situations, but it also is, um, you're predisposed and you're predetermined to thinking a certain way about somebody, even though you've never met them or anything like that, and that causes a lot of disparity. So trying to, um, because I mean, experiences are something that's very difficult for you to change, but trying to get a full 360 view of things and trying to understand people, just hearing their stories out, and trying to make it a more, um, I guess, a happier experience, is something that will influence your thinking in the future. Because if you have a positive experience with a certain person, if you see some person generally, because of your unconscious bias, um, that is somebody that's, of the same color, same something like that, same race, you'll generally consider that they are a kind person or something like that, or that you'll have the same positive experience. And I feel like that's a bad way of thinking. However, if you cannot fully combat your unconscious bias, that's a workaround. However, trying to combat it by saying that this is wrong, I should stop thinking this way, and I should really try to get to know people. That's the best way to,
I
um,
agree.
I guess, combat it. Um, but yeah.
Yeah. And this unconscious bias doesn't just go for race, right? It goes for gender as well. Because I
Oh,
think
I
one
agree.
of the things that doesn't necessarily get talked about to the extent
Mm-hmm.
that it should is like the is nursing and the discrimination against
Mm-hmm.
men in nursing,
Yeah.
because like it's been, again, goes back to gender roles, right?
Yeah. It's
Men are
very
supposed to be
female dominated.
protectors. They're supposed to be the hunters, the strong ones, the aggressive ones, the breadwinners,
Yeah.
But nursing requires different skills than a physician does per se. It requires like emotional intelligence,
Mm-hmm.
bonding, coordination, and like just like general people skills and like connecting on that level,
Yeah.
which is not necessarily attributed to men in general, which I don't think is right, because I think I'm a pretty empathetic person,
Mm-hmm.
right? And I think many other men are capable of doing that. And a lot of times, men in other professions will put down men in the nursing profession.
Yeah.
Even women will put down men because it's like, oh, we're women dominated. Why are you here? You must be whatever, like weak or something.
Yeah. Yeah.
Like that's not true at all.
Mm-hmm. Gender discrimination, again, ties back to the dominated fields and how, if it's like you're against, like, I guess a phrase that I use is going against the grain. If you
Yeah,
go against the grain of like a gender dominated industry, it's very difficult for you to integrate. So trying to find a medium where you're not, discriminated or made fun of, but also enjoying your job is something that's very difficult for people. Eventually they find their like area and they find
yeah,
what they want to do in their life. But at first, it's very difficult to, um, I guess, just keep things under control. Specifically because like there's so many factors that go into, um, like what decision or like what job they want to have. And if somebody chooses a job, that they're going to have for the entire life and they're discriminated against, I feel like that's very discouraging for them. And it's something that shouldn't
yeah,
happen because because people are putting like their best effort forward, or their best foot forward to try to, make, especially if in the medical field, to try to help people, and try to, um,
exactly.
help more people live, longer and things like that. But if you're just being, made fun of and discriminated against, I feel like that's something that's a big drawback that we have, and that's a big setback, on our society, I guess, and that relates fully back to, um, I guess, our gender, I guess, or like our thinking of genders, our ideology, where, like you said, men are supposed to be the breadwinners and the protectors, while women are supposed to be the
Yeah,
caring ones. Breaking those stereotypes is super important when it comes to not just the medical field, but all fields in general.
I agree. Yeah, and it's really frustrating because it's like, you personally can't do anything to solve it, because it's like a group effort. It takes time, and it's a collective effort, because it's a mindset, and it's that's one of the hardest things to change about people, is like a mindset, or like a traditional way of thinking. And it sucks, but I think just being able to shed light on it, I
Hmm.
think we're helping to play our part.
Yeah,
That's what I like to think.
I
Yeah,
definitely agree. Um,
yeah,
but something that's, I guess, different is like, I guess, the limited mindset, that stems from, gender-based discrimination, not encouraging further education. And so this, I guess, really ties into all, aspects where race, gender, everything creates a limited mindset on the person, where because of this discrimination, and the prejudice against somebody, they are discouraged from, furthering their education or getting like a doctorate and things like that. And that's
yeah.
why, where I previously talked about, there is a very few amount of women in the workforce. Like, our percentages, I can pull those up for you again. This It's very different because like in 2007 it was 28.3%, and
Yeah.
2010 we made a little bit of a stride with 30.4, 2013 32.6, 2015 34%, 2017 35.2, and 2019 36.3. It's a very
Hmm.
big stride. However, we're still not making a whole lot of progress. Um,
Yeah.
but at the same time, and that this is a bit of nuance, in 2019 marked the first time that the majority of U.S. medical students were women. That's 50.5%. So
Mhm.
men are being admitted less to medical schools due
Yeah.
to their high volumes, and especially going into race. A lot of races are being, I guess, of a um, how should I phrase this very well? I guess they are a minority, not an underrepresented like Asian
My
populations, things like
Yeah,
that. Um,
yeah, there's a prevalence of them
yeah,
despite
over
being a minority.
overrepresented minorities like Asian populations and
Yeah.
things like that.
Yeah.
Since there
Yeah.
is an abundance of them that are have the general, stereotypical doctor route,
Yeah.
they are being discriminated against by colleges and are not accepted to them nonetheless. Um, because of their, but they only accept like the best and the brightest, which
Yeah.
in a big applicant pool there are many qualified candidates that they can't choose just because they don't have enough room, which is I feel is very discriminatory against the people that really try.
Yeah, and it's not right,
Hmm.
because like coming from somebody who is Asian
Yeah,
and who also wants to go into the medical field,
me
right?
too.
Like, yeah, it's discouraging
it,
because the only reason I want to do it is because I feel as though going into the medical field can help the most people, like I can help the most people as possible
mhm,
because like, I know my mom had like a few surgeries. And they were very risky because there were some complications, and so I was really scared. But I was very grateful that the doctors were experienced enough and cared enough that they actually pulled through. And like when I was a kid, when I was just born, I was very close to dying. I was in the NICU for months
oh wow.
because yeah, I inhaled some stuff. I don't know, and then my lungs were like coated in it, and I almost died. I had a bunch of complications, but like I want to give back because without doctors and qualified medical professionals, I
Mhm.
wouldn't be here where I was. Am I
Exactly. And I feel
like
like this goes for
yeah.
everybody, right? Without doctors, we would literally all be dead because of their extreme, like their extensive medical knowledge is so helpful, especially because
Yeah.
like they are so regional, right? There's generally a doctor um close by, but there are like, we have our food scarcity, food droughts and things like that. There
Yeah.
are places where there's not many doctors, where there's a doctor, not a doctor for miles. And so like the unequal access to medical health care is something that we
Mhm.
have been improving on as just as a society, but is still prevalent, which I feel like is important to mention.
Yeah. I think that's also important to mention as well. Like just the notion that
Hmm.
there are areas that don't have that,
Yeah,
like rural areas especially
yeah,
coming from Tennessee, right? Like there are some places I know and some people I know who live miles away from a doctor. Like one of my like close friends from school lives like 40 minutes away from school, but where they live, right? there there's no hospital.
yeah,
Like
yeah.
there's literally no hospital. So my mom was saying like if I were here and I were having you, we'd have to get airlifted or we wouldn't even make it
Hmm. Yeah,
or something like that. And I was like, that's I never thought of it that like because I live like literally like 8 minutes away from two hospitals.
yeah, yeah.
Like yeah,
And not to mention, like, even if people can go to a hospital, the price of healthcare is so expensive that it's very difficult for um, low socioeconomic populations to afford it. Um, so I guess that is not only economically and financially devastating for the I guess the family, but it's also discouraging from entering the medical field, because it's like, why would I want to, I guess, economically or financially like disrupt an entire family just for like
yeah,
just to help them, and I feel like that is very discouraging for some populations, which I feel like if it is just demystified and if healthcare systems can change, I feel like we can have a more increased underrepresented population in our society,
yeah,
especially in the
yeah,
medical workforce.
yeah. Like this is a hot take for me,
Hmm.
especially being Asian. Like I understand why they're limiting like why there may be an unconscious bias against Asian people and like admitting them to medical school or like top colleges, stuff like
Yeah.
that. Like I don't personally I don't want to go to a college that's everybody's the same,
Yeah, I
right?
agree.
And like I understand it's wrong, but that's just the reality of it.
Sometimes it's
And
necessary, right?
exactly, it's necessary sometimes that colleges do that because colleges they want to encourage a fruitful, diverse environment.
Hmm. I agree.
And when you have a majority of something, it can't be diverse, right? And
Hmm.
so I definitely understand where they're coming from. It's discouraging, yes, but it just makes me want to work harder for the fight for diversity and for my own like personal academic goals.
Yeah, yeah, yep. I definitely agree.
Yeah. Yeah. And like when we talk about um, the medical field,
Hmm.
especially race,
Hmm.
and that which ties to gender as well, because these two things kind of go hand in hand
Yeah.
when it comes to the topic I'm talking about is like pay discrimination,
Hmm.
which is prevalent amongst pretty much all job types.
Yes, yeah, it's pretty much prevalent among all job types, and but we've
Yeah,
come a long way since I guess the
I agree.
Industrial Revolution. However, we are nowhere near, um,
Yeah,
I guess
I agree.
true, I guess gender equality when it comes to pay, which is
Yeah,
sad. But I feel like um, through lobbying and progressivism, I feel like we can have, um, I guess equal pay.
yeah. No, I definitely agree. And a lot of it also has to do with leadership. And like if you have like say a board, like I saw a statistic that was like the a board of like this orthopedic surgeons or something,
Hmm.
and only a few percent of that like sports medicine orthopedic surgeons were female, and that's pretty stunning because those people are in charge of like are in charge of your profession pretty much.
Yeah.
They're like the leaders. So yeah,
So
and
like
it's real.
sorry to cut you off, but just to add to your data, in 2020, the gender pay gap widened from 25.2% 2019 to 28%, where female physicians earning on average $116,289 less than men annually.
Oh my
Yeah.
yeah. So the statistic I was studying was orthopedic surgery. 4.3% of the board certified surgeons were female,
Hmm.
and that is scary
Yeah.
because you don't have with more diversity, you also have increased perspectives and voices. And once you have that, you can create a more equitable and equal environment that's good for both
Hmm.
genders. Genders, I say loosely because but
Yeah.
that's just the categories that have been studied. And I think that it's it's disappointing, but also that you see the opposite happen in other professions like pediatrics. There's a minority of men, and that's just the reality, and I believe it should change, but it's going to take a lot of time and effort to enforce that change.
Yeah. Going off your orthopedic surgery data, I also saw that where the widest pay gap was actually in orthopedic surgery. Who would have guessed? And with an average pay gap of, can you guess?
What? Oh
$122,677.
my god.
Yeah. So it's a very large average pay gap, which is something that's definitely like um it's a deterrent for people to, or I guess genders to enter the workforce, specifically because with a pay gap that large, it's something that's
Mhm.
very discouraged for other populations to enter in. And so
Yeah.
not many people would want to be the pioneer and stride in for,
Yeah.
I guess, be the first to, not the first, but
Yeah.
be, I guess, somebody that
Be a
enters
leader. Yeah.
with an extreme pay gap of $100,000
Yeah.
on average,
Yeah.
um, and do the same job as men, which is something which is saddening to hear.
Yeah.
But
And I think I'm sorry,
no,
just
no,
to
you're
like
fine.
add on to what you said about like gender pay gap in America, especially, open talk about salaries is very, very. like it's a very controversial thing to do
Yeah.
because like it's considered a rude thing, but personally, I think that it actually benefits everybody who is in the industry because with free open communication of salaries, you can compare salaries and compare workload and effort and work together to increase both salaries pretty much and form a more happy, cohesive environment. And I think that a lot of times what happens is since it's so hidden, like salaries are so secretive, women don't realize that I'm sure they realize, but they don't realize how much they're getting paid less than their male counterparts.
Yeah. I feel like making that
Yeah.
information public will help people realize, I guess, the true, I guess, deficit between the gender get pays, and so
Hmm.
making that information public will not only help create a more equal pay, but will also really show that, I guess, genders can work together.
Yeah.
Seeing as we have, as a society, improved the wage gap from a considerable amount. However, we've still have a long way to go, and so trying
Yeah.
to bridge gaps together in order to um, just make society a better place for people, especially for the
Hmm.
future. Because it can be discouraging for other populations to enter the workforce, for
Yeah.
younger populations to look up to when they're
Hmm.
not being paid as adequately as others. And
I agree.
so making that information public will help a lot of, will help not only people right now, but will help prevent a lot of issues in the future. Um,
Yeah.
because if it's not going to be solved now, hopefully, of course, it'll be solved in the future, which is something that I would be glad
Mhm.
to see,
Yeah.
personally.
Yeah, and I think some solutions, possible
Yeah,
solutions or steps towards the right direction is to in definitely increase diversity in the like certified board of blank in the medical field or like
yeah,
top leaders, national leadership in initiatives and medical programs, stuff like that. Because once you have that, it's like you work from the top down. Because once you're working from the down up, it doesn't really work because the top is dominated by one race or one gender, you
yeah,
know?
yeah.
And so it's harder to do that. So I think working from the top down and encouraging that and offering like incentives or something
I agree.
can over time, over a long time, definitely increase diversity in the medical field.
Yeah, slowly increasing the exposure as well of, I guess, people to, and especially younger populations, to the medical field, and I guess particularly of underrepresented populations, can also um, influence their decision to join the medical force, because people in medicine are always usually very busy. So
Yeah.
it's very hard for them to make time out of their day to, maybe, let's say, visit a school or something like that.
Hmm.
So trying to make it a more um, hospitable environment where people are exposed to um, the fields, rather than just, hey, this is the medical field, this is what we do, kind of thing.
Hmm.
Really
Yeah.
experiencing it head on by increasing the amount of internships and shadowing and things like that,
Yeah.
can really help teach students at a young age, especially in high school, about what they want to do in the future. And it's something
Yeah.
that I wish I could have done earlier. Hopefully, I still
Hmm.
get to do it. Just, and for people out there that are of high school age that have not gotten shadowing in our
Hmm.
internships, this goes for anything. Just ask local people, if you just can shadow for them. If they
Yeah.
say no, that's probably the worst thing that can happen. And if they say
Yeah.
yes, that's great. But
Yeah,
learning what you
exactly.
like to do at a young age is something that's very important.
Yeah, and I think, with time, obviously, and some changes to leadership and, you know, people more powerful than these doctors who have more power
Hmm.
can help increase the diversity and make the medical community more diverse, comfortable, and equitable.
I agree.
I think that we definitely can see some change in the future.
Hmm.
It's just a
It's a
matter of
slow process, I guess, right
exactly, it's
now.
a very slow process, and like it's a matter of who's gonna step up to do it,
Mhm.
who's gonna pass it through Congress
Yeah,
or through the whatever whoever runs the doctor
yeah.
organization if there's one. Yeah.
Right now we're in a progressive era,
Hmm.
and so we're having more people speak up about injustices, and which is very good. And so very soon there will be pioneers that will take that pay cut in order to express, hey, I'm like express the injustices among among the people, and so that's something that can help, um, I guess change the way that society thinks, especially surrounding um, the pay gap between professions, but especially the medical field. And so pretty soon, I hope to see um, a lot of change. But I guess it's a because it is a slow process because number one, it is the medical field. We're always
Hmm.
going to need these kinds of people.
Yeah.
But we have not had people talk about injustices, and if we have, it's not been very vocalized a whole lot um, in the past, and so hopefully going forward, um, it will be a lot more rapid change. But it's just depending on who takes that plunge and who takes that pay cut. Who advocates for
Yeah.
change first. Um,
Yeah.
so that's all it boils down to.
Yeah. I think so too. And with that, our discussion comes to an end. We thank you for listening and hope you'll stay tuned for future episodes. Don't forget to follow the Pepper Podcast on Instagram, Spotify, Apple Podcasts, and YouTube. Thank you.
Thank you.